Hello friends, this is Kuntal from YouTube channel MedLab Tech KP. This is our first video of our channel. I hope I will give you something extra from here. Today we discuss about the examination of urine, which is a vital topic of clinical pathology. It is the basic knowledge for all beginner MLT student. Before we start, I would like to request you please subscribe our channel and press the ring icon to get more new videos at instant after time of the upload. Okay, let's start our video. Examination of the urine, basic idea for beginner MLT student. Why I choose this area of clinical pathology? At first of the medical laboratory technology MLT course, you have to learn about the basic clinical pathology which are regularly done in all laboratories. Thus, normal value of every component of the sample should be remembered. Otherwise, you cannot tell that the positive or negative of the result in your hand. However, every normal value also provided with the report pad nowadays in all laboratories. Now question is, why urine is so useful in clinical pathology? Urine is excreted from the animal body as a waste material which comprises of many components that should be harmful if those are not excreted out from our body blood circulation. So if there are any abnormalities detected in sample, there must be something wrong in our body function. Let's next question. It is better to examine a fresh urine sample than a preserved urine sample because fresh sample does not have so much bacterial growth that it can give us the correct result. So examination of the fresh sample as early as possible better than the using preservative. Examination of the urine report are not only about the kidney related problems but also known about your whole body mechanism. Thus, we have to examine urine sample with correct procedure and be carefully. Now, urine report of our normal adult body. This is the main point of our video. Let's urine analysis, the simple diagnosis test for renal function in physical, chemical, microscopic and bacteriological examination of the urine. Note that here we provided normal values of the urine components and some common tests in laboratory. Later we read every test and their procedure broadly for future videos. Physical examination of the urine. The quantity of the urine in 24-hour sample, which is range 700 to 2500 ml or average 1200 ml per 20-hour sample. Order faint aromatic color amber yellow or pale yellow, appearance nil generally but cloudy due to phosphate if present. Sedimentation nil. Specific gravity 1.0032 to 1.030 or averagely 1.018 for normal. It is estimated by urinometer generally. Here urinometer picture are shown. In our next videos we will discuss about urinometer broadly. Then come physical examination. Physical examination, nature slightly acidic urine, pH varies 6.0 to 6.8. It should be basic. If basic, then at first we have to make acidic first, then examine chemical examination. And generally reagent strips and pH meter are used to detect the pH value of the urine sample. Then come albumin, generally nil or faint trace amount. The test for albumin, which is done by two types. Number one, qualitative test. Number two, quantitative test. The qualitative test are done by heat and acetic acid test, sulfosalicylic acid test, Hillard nitric acid test. In quantitative test is done by Esbeck's test. Those are very popular tests. Bile salt generally does not present, and it is examined by Hayes sulfur test, very popular test. And bile pigment generally absent. This test is done by Fauchett's test. Reducing substance, generally nil. Reducing substance detected by the glucose oxidized strips, Benedict's solution or Fehling solution. Excess of phosphate, generally absent, dissolves in dilute acetic acid. This is also a very good test. Benzose protein, generally absent. This is detected by the heat test, immunoelectrophoresis test. Ketone bodies, generally nil or absent. It is tested by the keto strip or Rothera's test. Rothera's test is a very popular test. Urobilinogen, generally present 0.5 to 2.5 mg per 24 hour sample urine, and it is detected by the Harlich's aldehyde test. Here a Benedict test diagram is described below. Color changes of the precipitate indicate the amount of reducing sugar. The blue precipitate shows the less amount of reducing sugar, then green much, later much, then yellow much more, and brick red much amount of reducing sugar present. Here left side diagram, heat and acetic acid test. Cloudy appearance indicates the presence of the albumin and phosphate. Albumin or phosphate, cloudy appearance due to. And the right side, the Esbeck albuminometer, qualitative test of quantitative test for the albumin in urine sample. Here the diagram for the Rothera's test detection of ketone bodies in urine. Note that the formation of the purple color ring indicates the presence of ketone bodies. Those are acetoacetic acid or acetone. Next is come microscopical examination. The microscopical examination should have with fresh sample, and before the test we have to done centrifuge with 15 ml urine sample at 2000 rpm for 5 minutes. Unrecognized deposit in the urine sample, those are urates, uric acid, calcium oxalates in acid urine, and phosphates and biurates in alkaline urine we can found. And abnormal constituents like leucine, tyrosine, sulfur crystal, hyaline cast, granular cast, cellular cast, fatty acid cast, waxy cast, etc. And RBC occasional, it's very less amount. Next we found epithelial cells, squamous epithelial cell, minimum in male, some maximum amount found in female. Pus cell may occur in normal urine. It is also less than 5 per HPBF. Microorganism also nil. Their Squamous epithelium pus cell left side and granular cast right side. Here describe the crystal, urinary crystal found, triple crystal, calcium phosphate, uric acid, calcium carbonate, ammonium urates, leucine, tyrosine, calcium oxalate, sodium urate, crystalline. Next, here granular cast, hyaline cast, white blood cell cast, waxy cast, spermatozoa, cellular cast in renal tube, epithelial cell, red cell cast, we can found in urine sample. This is the overview of examination of the urine. Next we will read one by one test and their procedure and important with diagram. For better knowledge, to read any good clinical pathology textbook, if you want this PPT or slide, then email me kuntalpaja100@gmail.com. Please subscribe our channel Made Lab Tech KP and like our video for future update. Thank you.